When I talk of non-surgical approaches to kidney stone, it encompasses two things. One is hydration, wherein the stones pass through the urine normally and naturally, and second is a procedure which is done to break the kidney stone, and it is non-surgical. This procedure is called ESWL. Small stones up to 4 millimeters are treated by hydrotherapy. However, a stone which is larger than 4 to 5 millimeters, let us say 6 millimeter or 7 millimeter or 8 millimeters or even 9 millimeters, some cases, we use sound waves to break the stone. Non-invasive, which means there is no cut on the skin of the patient, there is no anesthesia involved, and the patient is not admitted to the hospital and he can go home immediately after the procedure. The whole procedure takes about 30 to 40 minutes. Now, are there any tablets to expel these stones? No, there are none. There are tablets to expel the stone if they are in the ureter. But in the kidney, there are no tablets to expel the stone. Hydration has to work naturally, and with the help of some luck and some randomness, the stone goes out through the urine. Many people call it a laser surgery for stone or laser procedures for stone. Well, this is not a laser procedure. It is incorrectly labeled as a laser procedure for stone by the patient. This is a shockwave lithotripsy or soundwave treatment for the stone. This is not a laser treatment. An ultrasound scan is done after about 8 to 10 days to see what has happened. If the stone is not satisfactorily broken or the pieces are large, then this whole process is repeated again. However, if the pieces are 1 to 2 millimeters in size or they have powdered, then no further treatment is needed. We just wait so that naturally these pieces or fragments of the powder come out of the body. I am Dr. Girish Nelivigi. Today I will be talking of a very important topic which is so common in urological practice. This is the non-surgical approach to kidney stones. When I talk of non-surgical approaches to kidney stone, it encompasses two things. One is hydration, wherein the stones pass through the urine normally and naturally, and second is a procedure which is done to break the kidney stone, and it is non-surgical. This procedure is called ESWL. ESWL is nothing but using sound waves to target the kidney stone and break the kidney stones into small fragments, and the patient passes them in the urine. Now, which are the kidney stones which can be treated by this manner? Small stones up to 4 millimeters are treated by hydrotherapy, which means to say we ask the patient to drink about 2 to 3 liters of water every day so that at some point they go out. We don't usually treat by any method. Now, are there any tablets to expel these stones? No, there are none. There are tablets to expel the stone if they are in the ureter. But in the kidney, there are no tablets to expel the stone. Hydration has to work naturally, and with the help of some luck and some randomness, the stone goes out through the urine. However, a stone which is larger than 4 to 5 millimeters, let us say 6 millimeter or 7 millimeter or 8 millimeters or even 9 millimeters, some cases, we use sound waves to break the stone, which I have already told. Now let me talk in brief about this procedure called lithotripsy, shockwave lithotripsy or ESWL, all mean the same. There is a machine with a table. The patient is made to lie down on the table, and this machine generates sound waves from behind. These travel through the skin into the kidney, and using ultrasound or X-ray, they are targeted or focused so that they are targeted on the stone and they break the stone. This procedure is non-invasive, which means there is no cut on the skin of the patient, there is no anesthesia involved, and the patient is not admitted to the hospital and he can go home immediately after the procedure. The whole procedure takes about 30 to 40 minutes, and sometimes if the patient is uncomfortable, he can be given an oral or an injection painkiller. What happens after the procedure? The patient is asked to consume a lot of water and take some painkillers if there is pain. Most of the times they do not need a painkiller, and they are also given some tablets which will help in expelling the stone fragments. An ultrasound scan is done after about 8 to 10 days to see what has happened. If the stone is not satisfactorily broken or the pieces are large, then this whole process is repeated again. However, if the pieces are 1 to 2 millimeters in size or they have powdered, then no further treatment is needed. We just wait so that naturally these pieces or fragments of the powder come out of the body. So this is about lithotripsy or shockwave lithotripsy or ESWL. Now just one small piece of information. Many people call it a laser surgery for stone or laser procedures for stone. Well, this is not a laser procedure. It is incorrectly labeled as a laser procedure for stone by the patients. So I keep on telling patient, this is a shockwave lithotripsy or sound wave treatment for the stone. This is not a laser treatment. So I hope this information was useful. Thank you.